Hello everyone, you're watching PhysioClassroom channel and I'm making this video especially for those patients who come to the physiotherapy OPD or clinics with complaint of sudden onset low back pain. Now these are the patients who often give us the history that they were completely fine and there was no previous onset or previous history of low back pain in the recent time, but what they complain is that they were trying to bend and take something from the floor, and when they were coming back there was a sudden catch and they couldn't stand upright and then they have to crawl back into the bed. Or they can also give us the complaint that they woke up with low back pain and stiffness and all the motions of the spine became stiff and painful. Now for such patients I'm gonna give you the 4-step self-help process by which we can make this pain and stiffness go away in no time. And if these patients are misdiagnosed or not treated, then they can end up in being a chronic pain patients with having unnecessary investigations and management. So let's learn the 4-step process on how to get better with sudden onset low back pain and stiffness. Please keep in mind that before you start doing these 4-step exercises, you must visit a clinician or a competent physiotherapist to rule out any other pathology like a disc problem. And if it is so, then in those cases, please avoid doing these 4 exercises. These are the exercises which are going to relieve the low back pain and stiffness which comes due to the dysfunction of the lumbar facet joints. So the first thing that you have to do is to lie down on a firm surface and then take a hot water bottle and place it under your low back. Please arrange a stool or a chair, or if possible some 3 to 4 thick pillows so you can bring your hip and knee into the 90-90 position, and that is the position in which you are going to lie for about 10 to 15 minutes. Now please remember, you are lying in a position where your back is flat and then your hip and knee has a 90-degree angle. Now this is the position in which our facet joints and the muscles starts to relax and we tend to develop more relaxation along our low back. Now after you have completed this process of lying in that position for 10 to 15 minutes with a hot water bottle under your back, you can progress to the step 2. Also please remember that the hot water bottle that you are going to use should only be half filled. That means it should not be bloated, it should be malleable and soft and flat. Now the second step will involve the removal of the support that was there under your legs and the removal of the hot water bottle. Now gently start bringing both the knees closer to the chest and you will find a stretch-like sensation coming in your low back when you try to move your knees towards the back. Now these are your joints which are telling us that do not go forward, I am stuck. And we are going to respect that, and what we are going to do is we are going to stop at the barrier where we feel we can't go any further, and then we will very gently start oscillating the knees towards the chest in a very small amplitude, and these oscillatory movements will be carried out in a pain-free and comfortable manner for about a minute, and then we will relax for about 30 seconds and repeat this process 3 times. Now remember, motion is lotion, so when we go to the barrier and start moving our knees closer to the chest, this encourages relaxation in the muscles and mobilization in the joint, and we will start feeling more better and our knees will start going closer to the chest with every repetition. This is the second step, and now move on to the third step. To perform the third step, you have to go into the 4-point kneeling position. That means you are now going to be on your hands and on your knees. And from this particular position, what you are going to do is you are going to transcend or transform yourself into a child pose. So you are trying to sit back on your heels so that your buttocks are going as close to the heel as possible and your forehead is trying to reach for a touchdown to the mattress or the floor. Now once you are in the child pose, you come back to the starting position and now start repeating this process for good 15 to 20 times. The idea here is again to open up those facet joints which suddenly got cramped up and jammed, which were causing the pain and stiffness and not letting you to sit, stand or walk. Now after you have completed these 3 steps processes, the pain will automatically start reducing by at least 50% or more. The 4th step that we need to do is the self-mobilization of the lumbar spine. Now what we need to do for this step is we need to have a lumbar belt, which I'm going to bring. So You can use any mobilization belt, and what you have to do is, such patients will often complain that they are having stiffness and pain at one particular region. It can be bilateral or unilateral. So you have to place the belt right over, that means not over the level where you have the pain, just above it, right above where you have the pain. Grab it with both the hands, and then you bring both the hands forward and then start gliding the belt or moving the belt upwards towards the chin and maintain that traction. And now when you maintain that traction, what you have to do is you have to try to perform the sit to stand exercise while you maintain this glide with the belt. And such patients, what they do is when they try to sit, they are going like this because they don't have that forward motion. So remember, when you try to move with the belt, you are going to actually move with full motion of the spine and going down, and then again using the full motion of the spine and standing up. Now once you have done that, the last step that you will do is, again you maintain the same hold, and then while having that glide towards the chin, you start walking for about good 1 to 2 minutes, and then that's it. That's the 4-step process, and you will start feeling much better the same day. Also, please do remember that you have to visit a competent physiotherapist and also a clinician to get further advice on your pain management. It has also been seen that if we can combine these exercises with a good prescription of medication, which involves a combination of analgesics and a muscle relaxant, or as prescribed by your general practitioner, you will get much faster recovery. I sincerely hope that the information shared in this video is going to be helpful for you all, and you will be able to share this with people who develop sudden onset low back pain. Now before I conclude this video, it has to be kept in mind that these are not the exercises for people who develop acute disc prolapse, in which the straight leg raise test is positive, they are having pain on coughing and sneezing, or the low back pain is traveling down into the one or both legs, especially below the knees. So take care, bye bye, see you in our next video. Till then, keep learning, keep sharing, and stay connected.